we going to be covering GERD, gastroesophageal reflux disease, or acid indigestion, reflux, whatever you want to call it. It's that pain, that burning in your chest and back of your throat that occurs in particular in some people all the time, or in other people with certain types of foods or environments. It's estimated that roughly 20% of the American population suffer from GERD. Now, that's chronic gastroesophageal reflux disease. A lot more people have reflux every once in a while based on their activities and their environmental exposures. But the number given is anywhere between 15 and 30% for Americans to have chronic gastroesophageal reflux disease. The causes are many, primary ones being overweight. When your belly fat pushes up on your diaphragm, food easily makes its way back up along with the acid utilized to digest the food into the esophagus and back of your throat. So weight changes is a huge way to treat gastroesophageal reflux disease. Smoking increases it. Being pregnant, if you're a female and pregnant, can increase it. Same reason the fat does. All these things can increase the rates of reflux. Medications, there's a number of medications out there, from antihistamines to blood pressure medications like alpha blockers. Nitrates such as Cialis or Viagra can cause reflux. A lot of different medications are involved with the anti-inflammatories are another big one. Ibuprofen for your sore knee can give you reflux disease. Antidepressants, very common for a lot of the SSRIs to be responsible for reflux disease. Food triggers are many. Now we all know which foods cause it in each one of us, but fatty and fried foods definitely top the list. Citrus, chocolate, sorry about that. Coffee, that's one gets me once in a while. And then carbonated beverages all can increase reflux disease. So what do we do about it? In traditional Western medicine, we use medications to suppress the acid. The most common ones are proton pump inhibitors or PPIs. Examples of those are Acifex, Protonix, Omeprazole or Prilosec, Nexium. All those suppress the acid completely. Unfortunately, your body needs acid to absorb minerals. So if you're taking those drugs on a regular basis, you can actually have some issues down the road because you're not absorbing your calcium, your magnesium, all those important vital minerals for overall health and well-being. We also use antihistamines, what we call H2 blockers, Pepcid, Zantac, Acifex. Those are all H2 blockers that tend to decrease the amount of acid, not completely like proton pump inhibitors, but they lower the amount when you need it. There's a lot of natural interventions, and the first one being is lose the weight, lose the belly fat, and it'll help decrease that reflux. Raising the head of your bed up just a couple inches, maybe 2 inches on a brick on each side of the bedpost when you sleep at night will help with that reflux sensation. Not eating before you go to bed also is a very wise thing to do to prevent reflux, because that's when a lot of us have it the most commonly, is going to bed, eating a big pasta dinner with marinara sauce and then laying down immediately following, suffering reflux all night. Different natural interventions, keeping your weight down again is top of the list. Exercise. A number of supplements out there can be of great benefit. Zinc carnosine, aloe vera, papaya enzymes when you eat. All these things can help decrease GERD and reflux symptoms in a natural and holistic way. I'd encourage everyone to, if you have bad reflux and you're on chronic proton pump inhibitors all the time and you really want to get off them, find a holistic or functional medicine practitioner that can help you wean off those. Those are not drugs to stop cold turkey. You will get a terrible rebound reflux. So find someone to help you wean off them, utilize some natural supplements, help you drop the weight, and get off those drugs long term. There's a lot we can do for reflux. If you'd like more information, please feel free to contact us, and we wish you the best.